If you think that you're going to cure in medicine today, you need to go into some very narrowly defined specialties, because almost all of healthcare is living with bad disease. It may be early in living with bad disease, but you're not ever going to get rid of the fact the person has atherosclerosis. You're going to improve the blood flow, but the illness is still there. We should mostly be preventing what you can prevent, delaying what you can't prevent, and living well with the illnesses that you have to live with. An awful lot of healthcare is about being sick and, be it health. If you were interested in trying to get people to eat well or exercise, that you can deal with healthy people then. But most of healthcare is about people being sick and scared and limited and embarrassed and bankrupting themselves. And it's tough stuff. When you're young in the field, especially in medicine, most young doctors have been exempted from the ordinary experiences of life. So they actually arrive at being a doctor with usually very little experience of life. They've put off getting married, they put off having kids, they put off having a paycheck in order to get this training. Students need to get some vicarious experience. They can do that by reading plays and poetry and the great cultural works. Almost all of our great cultural works are about dying. So, read those sorts of things. Try to listen to people more carefully. Talk to older patients. Well, how does it feel to grow old? Talk to me about that. Give me some. We have access to our our playwrights right there. They're in the beds. Go sit down beside somebody who's going through a tough time and say, tell me a little about how this phase of your life is. Tell me how I should approach the next person I see who's in roughly similar circumstances. What would help you? What has already helped you? What has really annoyed you? What kinds of things have been trouble? By learning from your patients and learning from literature and arts and so forth, you can mature yourself from your perspective very quickly. It's sort of filling in all the little pieces. I mean, it's not like it's any one blinding flash of light that suddenly tells you, how to be a responsible doctor or nurse or somebody who's helpful to, to these very sick people. But it's more 1,000 stories that start building up a wisdom about how to relate and what it is that's helpful. What does it mean to be a person who was able to be a strong corporate executive or dock worker or something, and sort of be in command of a big chunk of your life, and now you're incontinent. Now you're never again going to walk. What matters here is, are you going to be able to recreate any dreams? Are you going to be able to have something you aspire to do? Just 2 weeks ago, your husband was planning to spend his retirement traveling and seeing the children and grandchildren and going around the world. He's never again going to be able to travel. Man is made of hopes and dreams, not just bones. And so can you recreate some dreams? So if you're a doctor, you need to know how to understand the likely course, to be able to prognosticate what's going to happen. You need to be very good at symptom control. You need to be able to be honest with people in a sympathetic, empathetic way that brings them along to understand their real situation. If you're a nurse, you need to be very good at the concrete skills of managing the body, keep the person from getting pressure ulcers or contractures, but also to be empathetic and to be able to listen and to be able to guide them in the right directions and support the caregivers and encourage the family to be involved. It's a real relationship. It's basically the promise that you're going to stay with them for whatever it is that is coming at them, that they are not alone. And underlying everything else you do is the promise that nothing is bigger than we can handle. And, I'll be here for you. These things are worthwhile. Even if they fail in some metric, it's a life. It's what you have to give. At the very least, I won't have to explain to my children that I did worthless things, that I wish I'd done something worthwhile in my life. These things are worthwhile.